right. We are going live in just a moment. We are live. Hey, Better, Richer, Stronger. It is a magnificent Friday afternoon here at the Jersey Shore, July 1st, 4th of July weekend. I hope everyone's doing well. I had just a private chat with my brand new friend, a guy I've been following for a while, Dr. Alessandro Bartoletti from Pennsylvania. And we just hit it off so well. I really want you all to get a taste of this magnificent young gentleman of dentistry. This guy's the future. So Alessandro, welcome to Better, Richer, Stronger. I'm really glad I've gotten to know you.
Hey, thank you very much, Alan, and likewise. It's been a great pleasure.
It really is. And the way I caught Alessandro fever is when you responded to my column on humanistic malpractice. And you really get the concept. I just coined the term off the top of my head. And
it's a great term.
Yeah, and you own that. Tell me about, tell us about, you're a wonderful clinical dentist. You get it done. We all do good dentistry, but your philosophy toward people. Tell me about that a little bit. Tell our group about that a little bit.
So it's something that, of course, progressed and evolved over the course of time. But what I realize and what I've gotten to realize actually is really, in large part, thanks to my former partner, Dr. Taylor, who has retired. But what I'm trying to do is take care of people, but make sure I take care of them well and on their terms.
Yes.
They have to be the ones to decide what happens, how it happens, and kind of dictate the flow of, well, the care that they receive.
Mm-hmm. Sometimes we discussed this before. We are inculcated in dental school with this authoritarian model that I'm the doctor and it's my way or the highway. Right. And I think for my generation of dentists, it was quite a shock when the tide started to turn. But you quite understand that. It's not about us. It's not about our brilliance, is it?
No, it's not at all. It really has to be about the patient. And, some people, it may take decades for them to, let's just say, keep on thinking about something, and then finally they will make the leap forward. But it's going to take time. And some people may never get there. And that's something that a lot of dentists have to realize, that us as dentists, we all want these incredible smiling, 28 or 32 teeth mouths, whatever the ideal happens to be for the different person. But it's not going to be for everybody. As much as we might want that, what we want doesn't matter. It's what the patient or the other person wants. And those two may not line up, but you have to accept what they want as the reality.
And keep it, of course, within clinical ethics.
Correct.
And that could be, for a gentleman like you and for whatever I am, like me, we've learned how to do that. It's not all or nothing. It's not ideal or hell. It is the best we can with the material we're given and the restrictions or limitations of the individual.
Exactly.
Yeah.
Yep.
So you served in the Navy.
I did.
And how did that add to your dynamic of being a practitioner?
Well, the Navy was, you could say, a great exposure to a wide variety of different people. So I got to meet different people from different backgrounds, learn about different backgrounds, make lifelong friends in the process. Many dozens of folks that I stay in touch with routinely, from the different places that I was stationed at, like DC, Japan, South Carolina, and then the Navy Reserves, Fort Dix, New Jersey, in that area.
So really? You're at Dix?
I was at Dix from 2012 to 2017. Yep.
I did a lot of dentistry at Fort Dix in those years.
Okay. All right.
Yeah.
So, I was there for, well over 5 years. Great experience there. And so I got to see and meet a lot of different people and see different techniques being done, different things clinically being done. So I got to learn a lot in a lot of different respects in dentistry. And that was very beneficial.
Mm-hmm. Outstanding. And the other thing I want to touch on very briefly, this is just a pop on, and you will be coming back for more, will you not?
I absolutely be happy
So
to.
I'm from Jersey. I got friends.
I know that.
Yeah. So you are in your mid 40s,
Yes.
and you've got teenage children.
One, yes.
Mhm. So balancing you have a very busy practice
Yes.
out in central Pennsylvania.
Yep.
How, when did you realize that you needed to balance your busyness, your ability to earn a proper income that gets you what you want, and balancing that off with your wife and your family?
That actually, I mean, do I realize it? Yes. And I've realized it for years and years ago. I knew that there had to be some sort of a work-life balance. The challenge is always making it happen,
Mhm.
because life can throw a lot of curveballs at you. Life can get crazy. The pandemic taught us all of that.
Yeah.
But yeah, it's a constant work in progress. And yes, do I have, you could say, envy of those who have greater amount of time than I do with their families? I do, because I wish I did have a greater amount of time with my family.
Mhm. But you do have the time.
I do have time, yes.
Yeah, you're from what I gathered from our conversation, you don't do night hours.
No, there are no night hours at the practice.
And I had a gentleman come across my life, very successful dentist right near where I practice. And he sat across a mahogany desk from me, put his glasses, where are my glasses, down the tip of his nose, and looked up at me like this. He said, "Alan, dentistry is not meant to be practiced at night." And he said it in such a forceful way. Who the heck wants a tired dentist?
Yeah, yeah, that's a great point. I can't fathom working at night. Now, on occasion, if you get the very big emergency patient, for whatever reason, or trauma that happens late in the afternoon or evening, sometimes you have to go in and help folks out, and sometimes it's going to be late at night. But that's much more the exception than the rule.
Yes.
Our hours end at 5 o'clock, and I work as hard as I can to get everybody out, by 5 o'clock or shortly thereafter, because our team has, they have their families. They've
Right.
got to go to their families. And that's critical, making sure
Yep.
that the team that I've got is well taken care of, that we're not burning them out, that we're not expanding hours and doing crazy things. We keep the hours the way they are. That way our folks can indeed go home to their families just like I can.
And I think right there is the most powerful thing you can say.
Yeah.
Because you are what our friend Paul Goodman calls a middle-aged dentist.
Yes, we are.
I am a GAD, a geezer age dentist. Paul calls it a golden age dentist, but if you can't laugh at yourself, you can't laugh at anybody else.
That's true.
And I think that message that you just sent out with those words that I really want to amplify, especially to the younger dentists, the baby and toddler age dentists,
Yes.
is that there is nothing more important than those you love.
Yeah.
And including the other message you sent out is you're taking care of your team.
Yes, actually, that's probably the most important thing in my practice, and how I feel about things. It's, if you don't take care of your team, you're going to be toast. So
Mhm.
you need to make sure that your team comes first, not your patients first. Your team comes first. Now, your patients are a close second. Don't get me wrong. It's not like you're going to dump the patients off on the side of the road, but your team has to come first. They have to be well taken care of. They have to be treated well, and they have to make sure that they know that. And I'm lucky. I mean, my team is great, and they know that I take good care of them. If they ask for certain instruments, like if our hygienists, if they ask for certain things, they say, "Hey, we really need this in order to do our jobs." They get it.
Yeah.
Period. There's no hesitation. It's like, what do you want? What do you need to order? Let's get it to you. Same thing with the assistants. Hey, what do you guys need? Is there anything? I always ask them, keep on doing so routinely. Do you need everything? Is there everything working well? If not, what isn't working well? I've got to know what it is so I can do what I can to fix it.
That's powerful words.
Thank you.
Powerful words.
Thank you.
Because, and I learned the same thing. The most important people are the ones who help support you
Yes.
in what you're doing. They
Yes.
don't, in my world, don't work for me, they work with me.
Yes, exactly.
And it's not me, it's the mission of the practice. We
Yes,
all work together for the mission of our practice to be a force for health and wellness in our community.
correct.
That's the mission. That is my unique vision. Not so
Yeah.
unique, but it's the one that I
Well,
adopted.
we're on the same page, Alan.
Yeah, very much so. All right. So look, it's Friday afternoon. You've got a wife, you've got a kid. I want you home and
Yep.
balance your
I'll
life.
get
Have
there.
a great fourth. But what I'd
Hey,
love
thank
to
you
do,
too.
yeah. Well, I've got a wife. The kids are gone. One's in DC and one's in Atlanta. My wife's coming home. We got the dog downstairs and we have stuff
All right.
to do. But let me ask you this. I
Yeah.
would like you to come back and I
Yeah.
want to have a chat with you offline beforehand. I want to
Will
talk
do.
about practice culture, KULCHA in New Jersey, culture.
Culture.
Because I think a gentleman like you radiate a positive culture.
I
And I
appreciate
think
that.
that's
Thank you.
critical. And one final parting shot, my friend.
Sure.
Tell us briefly about your YouTube channel, because I've looked at some of that stuff. It's amazing. And just quick, simple, easy to understand stuff that you just slam out. Tell us about the YouTube channel, how to get it, and just a little bit about what's on it.
So, how to get the YouTube channel. If you go to YouTube and you type in all in one word, DRALESSANDRO, you will find my YouTube channel. Once you click enter, it'll kind of come up and you can watch all my videos, some of my videos, only the ones you want to see, whatever interests you, you can watch those videos. Think of it as an amalgamation of dental stuff. That is, it's a whole bunch of different topics thrown together, and it continues to grow as time goes on and as I film new videos and new topics. But I can't say I focus on any one thing. It kind of goes with everything. And so one thing I also do is I actually try to film videos based on requests. So if somebody says, hey, why don't you try to make a video, or I would like to see maybe a video on such and such a topic, I will do what I can to create a video on that topic. So some of the videos you see are indeed requests from folks or suggestions from folks for topics for the channel.
Outstanding. So can I request that you play Stairway to Heaven?
Stairway to Heaven.
Yeah.
I'd have to ask, I think, was that Led Zeppelin who played that?
Yeah. Yeah.
I'd have to ask Led Zeppelin for permission to use that. And that might cost me a pretty penny in the process. So I'm not sure if I'll be able to manage that, but who knows? Maybe someday I will be able to.
I think the beauty of your stuff is it is so brilliant that anybody can understand it.
Thank you.
Break it down into simple stuff, and that's one of the definitions in my mind of genius. So I would encourage you all. There are some people out in this dental world who are really worth listening to, and Dr. Alessandro Bartoletti is one of these budding, relatively young superstars. You got to watch this guy.
Thank you. Thank you, Alan. I appreciate all that.
Alessandro, we're going to see you again here at Better, Richer, Stronger. This was just an impulse buy.
Hey,
and I'm so glad we connected. And
likewise,
we're just beginning, my friend.
We are. I appreciate that. Thank you, Alan.
All right, stay with me a second. Everybody have a great Fourth. I got a great idea from my mentor, Mark LeBlanc. This is the 4th of July. This is Independence Day.
Yeah.
If you see a soldier out there, why don't you go out? And Alessandro is in the Navy Air Force Reserves now.
Air National Guard. Yep.
Air National Guard. So if you see a soldier, why don't you thank them for what they do for the 300 million of us who enjoy this most imperfect, wonderful country? Without them, there wouldn't be us. So Alessandro, I thank you for that.
Thank you, Alan.
Eat right. Have a hot dog this weekend. That's okay, but eat right. Drink lots of water, get lots of sleep, get some exercise like me and Alessandro. Most importantly, make somebody's life better each and every day, because that's why we are here. And of course, like the guy wrote in the book, enjoy the ride. I will see you again real soon. We're done.
All right.
I always